All right, so first we have the shoulder joint or the glenohumeral joint. It is a ball and socket type joint that deals in flexion, extension, abduction, adduction, and internal and external rotation. And move to the frontal, the sagittal, the sagittal, and the transverse planes, making a triaxial joint and having three degrees of freedom. Then we have the elbow, which consists of the humeral-ulnar joint, radial-ulnar joint, and the humeral-radial joint, which allows it to be a hinge joint and a pivot joint, meaning it can move with flexion and extension, and then pronation and supination. I want to move through the sagittal plane and the transverse plane, making it biaxial, giving it 2 degrees of freedom. And then you have the cervical spine joints, which are the atlanto-occipital joint and the atlanto-axial joint, which are both pivot joints, which allow for pivot and hinge joints, which allow for flexion, extension, adduction, abduction, and internal and external rotation, moving through the frontal, the sagittal, and transverse planes, making it triaxial and giving it 3 degrees of freedom. Then you have the wrist, which is the radiocarpal joint. It is a condyloid joint, which allows for flexion, extension, and then abduction and adduction, or radial and ulnar flexion, moving through the frontal and sagittal planes, making it biaxial and giving it 2 degrees of freedom. Then you have the hip, or the iliofemoral joint, which is a ball and socket joint type joint, allowing for flexion and extension, adduction, abduction, and then internal and external rotation, allowing to move through the frontal, sagittal, and transverse planes, making a triaxial and giving it 3 degrees of freedom. And then you have the knee, or the tibiofemoral joint, which is a hinge joint which only allows for flexion and extension, moving through the sagittal plane, so back and forth, making it uniaxial and giving it only 1 degree of freedom. And last but not least, you have the ankle, or the talocrural joint, which is also a cannuloid joint, which allows for dorsiflexion and plantar flexion, and then inversion and eversion, allowing it to move through the sagittal and transverse planes, making it biaxial, giving it 2 degrees of freedom.